Good morning. It's August 4th, 2020, and I'm looking at Pennsylvania data for today. There's my dashboard looking at how many individuals in Pennsylvania are ill or tested positive, I should say, not ill, tested positive with the coronavirus. We have, at this moment, 110,970 tested positive and 7,209 deaths. And then there's 3,185 probable cases. If we look at the overall average, running average in Pennsylvania, we see that there's an increase over time, again, through August. I don't think it's going to get to where it was earlier because people are taking precautions. Back in that period in March, there were very few precautions. At least now people are taking precautions. In terms of deaths, we can see that the trend is where we want it to be. So while people are getting infected, they're not dying. Now, some will argue that, wait a minute, there's all these long-term effects. But we don't know how many people those long-term effects occur in. So we need time to understand that. It may be that every single person that's ever infected with the virus will have some, will die young. I don't know. We don't know that yet. We know nothing about it. So we can't generalize from a sample, a small sample that we see effects in to the population as a whole. That would be foolish. That doesn't gel with what statistics are about. Let's look at this epidemiologic curve where it's broken down by region. We can see that the southeastern region, which includes Philadelphia, has the greatest surge, followed by the southwestern region. However, I would note that the slope here, right, is a lot steeper going down than it is going up here. So that's probably, again, related to the fact that many people are following the rules, wearing masks, etc. So that's good news. As we look at Pennsylvania by hospital preparedness, we see right now there are 103 Pennsylvanians on ventilators. Now it's really hard to see with this small big figure, so I'll make it I'll enhance it by clicking their view in full screen. It might take a second for this to occur, but we're not using a lot of the ventilators. Now, some people will argue that, wait, we don't want people on ventilators because ventilators are bad. Oh, well, that's a separate issue. Yes, if I get sick and I'm so sick with the coronavirus that the option is ventilator or no ventilator, I'd ask people to not put me on a ventilator and use alternative methods unless it's an absolute necessity. Apparently, though, it's not an absolute necessity. So these are the same data. It's just not working really well today because it's giving these very, very small tabs, but I'll do the best I can. It shows that there are 103 Pennsylvanians on ventilators for COVID. There's 918 on ventilators total in the state. So if we need ventilators, we have plenty. So that's important. This is really small and it's hard for me to see, but it shows the percentage of individuals in adult ICU. I believe it's 23.9%, or it could be 28.9, but that's how many. This is the proportion of ICU beds available. Okay, this is 30 here, so it's about 28.9% of ICU beds, adult beds are available. Surgical beds, 24.9%. I think this is pediatric ICU. We're at 18%. Now, this is not because of COVID. This is in general, all through the state. So if we have a surge, we would be okay. I'm not really sure what this is. It says pediatric, but pediatric what? And, this is for airborne isolation units at 44%. So we're doing okay in that case. If you look at here, number of COVID-19 patients hospitalized, moving average in the past 14 days. So we see that there was a decline, increase, and then back to decline again. So I think that I can't speak for all states, but in this state, people are doing some good things in that they're heeding to the warnings. Now, not everybody is. I was at a grocery store yesterday, and I saw this woman with the mask underneath her mouth and just going around and being happy and everybody talking to her, and I'm like, what the heck? See, the thing is, we have to pay attention to the rules. Now, people tend to believe that, well, either they think COVID is the worst thing ever, or they think it doesn't exist at all. This binary thinking is terrible. We need to take an approach that's more realistic. COVID is here, and it's not going to leave. We need a vaccine to get rid of it, or at least that we have enough people are vaccinated where we have herd immunity. And people have finally learned about what herd immunity is because it's been in the news, but before that people didn't care about it. But herd immunity protects people who are both those who cannot get vaccinated and then those who choose not to get vaccinated. I wish people who are anti-vaxxers, whatever you call them, would come up to me and thank me and other people who get vaccinated for getting vaccinated, because it's because of us that they and their children are not getting sick. I'm not blaming their children because their children have to get their parental permission to get vaccinated. So those poor kids, they are at the mercy of their parents. But in terms of people not wearing masks and not following rules, everybody expects that it will be the Trump supporter that doesn't wear masks, because what Donald Trump says about this virus, and many of his supporters do indeed feel that this is a hoax. But what really surprises me is when I see all the other people not wearing masks, the ones who are not the prototypical supporter, and it happens everywhere. If the amount of people that I see not wearing masks or not following the rules are all Trump supporters, then we're screwed if you're anti-Trump, because he's going to win the election again. So what's happening is that people talk the talk, but they don't walk the walk. Everybody says they want to do the right thing, but they don't, because that's what our world has become. It's become this social media fixated world where people have to say the right thing, but they don't have to do the right thing. So when I was out for a walk yesterday, and I go for these long walks all the time, when I'm behind people for a bit of time, my mask goes on. When I'm passing a lot of people, my mask goes on. My mask is protecting them, but it's also providing me with protection. There's this belief, and it's rightly so, that masks are more for protecting others than they are for you. But there's enough data out there from actually good studies, if you were to take time to look at the literature, go to Google Scholar, that masks do offer some protection. So they are offering me some protection. So I pop it on. I'm a public health professor. I have to practice what I preach. So I ask all of you to do the same. Pennsylvania right now is looking a lot better than other states. And the reason it's looking better is because people are doing the right thing. I'm just scrolling through to get back to where I originally was. People are doing the right thing here. Not everybody, and those people are causing the delays that we are seeing to continue. Until we get a vaccine, we have to live with this virus. No, we cannot shut everything down again. That's stupid. It's foolish. Whoever says we have to shut everything down is being unrealistic and is privileged. People talk about there being a thing called white privilege. There's something called economic privilege as well. People who have money are saying we have to stay home. Well, that's not the way the world works. People have to go to work. People can't go to work when they have children at home. We have to figure this out. And the only thing we can do right now is follow the rules. Wear masks all the time. The amount of a reduction in the disease we would see if everybody complied to mask rules alone and washed their hands regularly would be amazing. So we need to wait until the vaccine comes. And when the vaccine comes, it's not going to be given to everybody equally right away. It's going to be hopefully equitably distributed. But I fear that it'll probably go to the wealthier people as usual first. But hopefully it'll be equitably distributed. And when it comes to where we have this vaccine and people are getting vaccinated, then everything returns to normal. In the meantime, be smart, because we are the change agents here. Thank you very much and have a nice day.